There is your question. Please begin reading. Right, so if you have read and understood, considering it history taking station, please begin.
Yes, hello, I'm Dr. Ahmed Abdu, one of the surgical doctor here. May I confirm your name and age, please?
Hello, my name is Anna. I am 7 years old.
Good.
Okay, nice to meet you.
Nice to meet you.
What's brought to the hospital today?
I brought with my husband. I can't remember what exactly happened. I blacked out, and he told me some. I go through some abnormal movement. Through that, I can't remember exactly what happened.
Okay, I'm sorry. Sorry, I'm very sorry to hear this. When did you first experience this?
It's first I have this abnormal movement. It started just once. It was today morning.
Okay, I'm sorry to hear this. Can you describe what happened exactly? Is that all your body moved or one part of your body?
I just tell you that I can't remember what happened. I just blocked out. So my husband, I think he was there.
Okay, what you are doing before this happened?
I just watching TV.
Okay, there is anything unusual you felt then, like headache, anxious, chest pain, anything like this?
No, but I have some bad feelings that something bad are going. It's an unpleasant sensation.
Okay, so you don't can remember anything exactly during this seizure, like
No,
any head movement or biting your tongue or soiling or wetting yourself.
yes, when I regain conscious, I found myself with myself, and my husband describes this that I am has this vigorous movement, but I didn't bite my tongue, nothing like this.
Did it happen or night or on morning?
At today morning, I just tell you.
How frequent did you experience this episodes?
It's my first.
Okay, what's happened after this, or how it take long for you to get back to normal?
My husband said it's around 1 minute.
Yes, after this, there is anything happening like memory loss or aching or feeling to fall asleep or any weakness or in your hand or legs?
No, nothing like this.
Okay. Did you get any head trauma before?
No,
Or any fever um, or any
no fever.
weight loss?
Yes, my husband noticed that I lost around some weight of my body.
Okay, sorry to hear this. What about do you have any do you have any medical problems or
Yes, my blood pressure is not going well, and I also has diabetes.
okay? Do you take do you underwent to any previous surgeries?
I removed my appendix when I'm teenager.
Yes. Do you have any non-allergy against anything or medications?
No,
There is anyone of your family suffer from the same condition?
no, but my aunt died from after brain surgery 15 years ago.
Okay. Do you take any long-term medications except the
Yes, for my
hypertension?
diabetes, I take insulin, and my hypertension, I goes for some medication.
Okay. Can you remember them?
Ramipril.
Yes. What do you think about your problem? What's the cause?
I'm very afraid it need be something serious, that something like what killed my aunt.
What is the most thing you are concerning about?
I'm afraid maybe cancer or something like this.
Okay. What do you expect from us to do for you?
I need to sort this out.
Okay. Do you have any problems in your other systems, like problems in passing urine or troubling in GI in your in your disturbance in bowel habits, problems in your chest pain or anything like this?
No, nothing. I didn't
Do
experience
you want to tell
anything.
me anything or anything I have missed? You want to tell me?
No, thank you. I have no questions.
Thank you, and I hope you get better soon. Today I have taken
Okay, you
history.
can, yes, summarize your history.
Yes, today I have taken history from Mrs. Mann, 67 years old, brought to our accident emergency department with with seizure. Happened this today's morning, sudden, and preceded by preceding by watching TV, and during the teaser there is urine incontinence, and after that there is no there is there is no ictal symptoms. The patient have a medical history of hypertension and diabetes mellitus and take medication for them, and have a family history
Okay,
of a positive family history of aunt died from cerebral aneurysm.
so what are your provisional and differential diagnosis for her?
My diagnosis will be going for maybe brain tumor, and my differential diagnosis will be I will also consider meningitis, encephalitis, and
Okay, good.
epilepsy.
What investigations would you ask for to confirm your diagnosis?
I will ask for brain CT and
Yes,
MRI.
yes.
Then I will ask for EEG investigation.
What treatment can you offer her?
Depend on the condition of the patient. If he is normal status, if he in normal status, I will discuss her case with the multidisciplinary team and neurologist. If he is under attack of epilepsy, we have to go after anti-epileptic drug after making the ABC protocol or
Yes,
CRISPR protocol.
which anticonvulsant drug?
Like benzodiazepine and phenytoin.
Okay, how would you give? How much dose?
It's I can't remember.
Okay, then what else would you consider? Because your primary provisional diagnosis was brain tumor, So you'll discuss it with neuro-oncology MDT team before you'll decide any management. What else would you do? Or what else can be done?
I have also considered hypoglycemia and
Yes. Any
and
metabolic disorder, yes. And
metabolic disorder or cerebrovascular aneurysm or
yes,
or head trauma or
That-
epilepsy.
yes. That will be ruled out with all the CT brain and MRI and everything that you'll be doing. But what I was thinking that maybe you'll discuss it with neuro-oncology MDT team, and then you can decide of doing a guided biopsy maybe, and then you can
Yes.
maybe decide what to do next if it happens to be tumor or whatever. All right, good. So the feedback, if anyone wants to give, it was good, but some questions you have forgotten to ask. It was very nicely you began. You asked open question that what has brought you here and how you can help. You asked about the trauma when the patient fell. You asked about all the associated questions with even the patient itself told about the witness, but you forgot to ask how patient felt when patient regained consciousness. Was patient alert? Was patient confused? How was patient feeling? And then you can ask the patient how this episode was different from the previous episodes of fall that patient has had.
Okay.
Okay, so these two questions you could have added. Did you ask if patient has had a tongue bite
Yes, he asked
during
it.
fall? Okay, good.
Yes.
If patient, he did ask if patient had any fits or any unusual jerks or shaking of the body when patient fell. So,
I asked
yes,
about
I think you asked. I think you did ask. All right. So these are the things that you missed. You did ask about the aura as well. So yes. Good. Thank you.
Thank you. I think this station is very tough.
Yes.